At least 2.6 million Kenyans may have already been exposed to the coronavirus, and this is according to a preliminary study done by the KEMRI Wellcome Trust. Our reporter Dorcas Wangira reports on what the preliminary study tells us and why we are still not yet winning the war against COVID-19.
The research commissioned by the Ministry of Health and conducted by the KEMRI Wellcome Trust between April and June from among blood donors in Kenya shows that COVID-19 infections is highest in Nairobi with a prevalence of 12.4%. Nairobi with a population of 4.3 million, a total of 550,000 individuals have been exposed to the virus. Rift Valley has the second highest exposed population with a total of 510,000, Nyanza 410,000, Central 370,000, Eastern 320,000, Western 220,000, Coast 200,000, and no prevalence in Northeastern. This is because only 41 blood samples were picked up for the study. The report shows that cumulatively 2.6 million Kenyans may already have been exposed to the virus.
Prevalence, what we mean is we want to look at people who have developed antibodies to the coronavirus. The data tells us is that if we look at those places where we had a fairly good number of samples, we are able to determine the percent prevalence.
The study looked at the presence of antibodies in 2,535 blood donor samples from different regions in the country, and using a modeling formula involving the population in each region, the blood samples from 6 regional blood banks shows that there could be a huge gap between confirmed cases and the actual number of people exposed to the coronavirus. Dr. M Kenyans, an infectious diseases epidemiologist, both at the University of Liverpool and the University of Nairobi, however, says the study should not be misinterpreted. The sample size was too small. For instance, in Nairobi, only 137 samples were tested, whereas the actual population is 4.5 million people.
A caution in terms of the sampling strategy of the approach. This is convenient sampling. So it's not kind of a randomized, kind of approach. This is very convenient and is based on the availability of people. There's a potential actually to induce bias in the analysis. But if you wanted to conduct a true prevalence study, you're going to go in sort of a blind effort, whereby you are approaching an entire population and randomly go into populations and try to sample these populations and run the antibody test and be able actually to say, are we seeing antibodies?
Ideally, such a study will inform the Ministry of Health's policy, especially at this time when Kenya is bracing itself for a projected September peak.
The WHO and African CDC uses the same template, whereby you need to have about 14 days of actually having either no positive case being reported at all, or probably having very low numbers, for you to confidently make a decision based on the evidence that we are winning the war against the virus. So as it is right now, I think we are not winning the war.
The study also raises the question, if I was exposed to the virus and survived it, does it mean that I am immune?
It doesn't mean that if you've been exposed to the virus and survived without knowing it. I think that's the main concern. People are, writing these things and saying, I think I got sick earlier on and I survived this. So it means that I'm immune to this. Some people are saying, in February, my mother, my wife, whatever, got very sick and they recovered. So this is the thing. We need to understand that you cannot just develop immunity by being exposed to the virus.
Based on the data, the report predicts severe cases and deaths at the country's peak. Going by current models based on the data, more than 6,000 deaths are predicted, with Central and Nyanza regions projected to record the highest numbers. Dorcas Wangira, Citizen TV, Nairobi.